Medford, Oregon, home to over 75,000 people, on their way home, to work, to the lake. Nearly 75,000 stories converging at the restaurant, on the trail, and in the shops. In southwestern Oregon, many of those stories will converge here, Rogue Valley Medical Center, where lives, skills, and the education of caregivers will merge to give priority to one life, the next patient.
We do an annual risk assessment, and about 4 years ago, one of those risks for our organization was some of our environmental cleaning processes at the time.
People didn't understand several years ago, about infection rates and hospital-acquired infections, and the importance of cleaning and why they're doing it correctly is so important for those outcomes.
What we wanted to do is be able to lend that expertise that we have in setting up training and educational programs actually to the environmental service department. And so we had to come up with a creative way to be able to meet our goals and actually work within what resources we had available.
Everybody was very committed and very focused on what was the right thing to do for patients. And then I think having teams that are willing to be creative and look at how could we do this. Doors started to open for us, and one of those doors was to be able to get some grant funding.
So through the grant, we were able to hire the infection control assistant and provide education to that person for infection control training.
Both of our techs that have helped us in the project are people that come from the front lines. They worked in that department. And so they helped us identify the needs and then get together some training materials.
So we purchased a whole series of the DVDs that are available through the Association for the Healthcare Environment, so that we're able to provide that basic training to all new employees that come in through environmental services in a classroom setting, and it's about a 1-hour class.
The second year, that process developed into an environmental services fair that we partnered with our safety department on.
One of the main goals I thought was to kind of take down any type of barrier between environmental services, infection control, and safety, and it gave us a really good opportunity to get to know the environmental services staff.
We used all of those teaching materials and that same basic concept to create our infection control skills lab.
The Skills Lab gives the opportunity for hands-on training and one-on-one time where questions and answers and clarification can happen, and it's really been a really good thing that we've been able to do.
People really have to know what they're doing, but in addition, they really, really need to know why they're doing it.
They truly want to do a good job, they're interested in doing a good job, and they want to do it correctly. That was one of the things that we kind of struggled about at the beginning with the quality program, is, how housekeepers are going to react to that. Are they going to feel punished?
Because I do a lot of the footwork, I've been able to really interact with the environmental services staff on a daily basis. And just to explain, no, it's not personal. We don't take your name. It's just numbers. We're collecting data for our research so that we know where training areas need to be.
We did get a lot of feedback from staff that they actually felt more valued, more appreciated, because we'd invested the time in them to help them understand, or to make sure they understood, or that they had the training that they needed to have to do it the right way.
It takes a while before you can really see a result from changes, and we make so many changes at a time. It's always hard to really pinpoint one specific change and then equate results of data to really support it. All of our indicators have continued to improve. Our hand hygiene rates, especially in our environmental service staff, are higher than any of the other groups in the organization for the most part.
Our patient satisfaction scores have gone up. They've gone up over the last 4 months, but they are significantly up from last year. Whether we're patient care staff, whether we're infection control, whether we're EVS, it takes all of us to make the patient's experience positive.
Whether you're doing that with cleaning a room or collecting data or doing direct patient care, we're all here to take care of our patients.